Hey everyone, and welcome to The Explainer. Today, we're jumping right into some super important stuff, how to manage stress and crisis. These are the absolute core concepts you're going to need, not just for your exams, but for your actual practice out on the floor.
So here's the game plan. First, we're going to look at what stress actually does to the body. Then, we'll talk about our playbook as nurses when a patient's in crisis. After that, we'll dive into why every patient's situation is different. And, super importantly, we'll cover caring for ourselves. We'll finish up with a quick recap of everything you absolutely have to know.
All right, let's get right into it. What is actually happening inside our bodies when those stress alarms go off? It's a really powerful process, way more than just a feeling.
So, we all say, I'm stressed, but what does that mean physiologically? Well, it's not just a feeling of being swamped. Clinically, it's a huge, body-wide event. The neuroendocrine system basically hits the big red button, unleashing this hormonal cascade that's all about one thing and one thing only: survival.
This guy, a physician named Hans Selye, he's the one who really figured this out. He mapped out this predictable three-stage response that our bodies have to any kind of threat, and he gave it a name: the General Adaptation Syndrome, or GAS for short. Okay, stage one, the alarm stage. This is fight or flight, plain and simple. Your nervous system just freaks out, right? It floods your body with hormones. We're talking cortisol, epinephrine, the works. And what happens? Your heart rate skyrockets, your blood pressure shoots up, your blood sugar spikes, all to get your muscles ready to either fight for your life or run like heck.
Now, if that threat doesn't go away, your body shifts into stage two, resistance. It's basically trying to calm down and get back to normal, to repair the damage. And here's the tricky part. The vitals might start to look okay, but don't let that fool you. Under the surface, the body is burning through a ton of energy just to keep things stable.
But what if the stress just keeps going? Well, that's when you hit the wall. Stage 3, exhaustion. The gas tank is completely empty. All those systems that were trying so hard to compensate, they fail. The whole body just can't adapt anymore, and it starts to break down. This is when people get really sick.
So here's the big idea. The thing you have to remember, this constant state of alert leads to something called allostatic load. Think of it like running a car engine in the red 24/7. It's the long-term wear and tear on your organs. And this is what's so dangerous. It leads to real physical problems, like a weakened immune system and high blood pressure.
Okay, so we've got the physiology down. Now let's pivot. What do? What's our role as nurses when a patient's ability to cope just shatters and they're in a full-blown crisis? Listen, before you do anything else, I don't care if you're thinking about teaching or planning or charting, your number one job is safety. It is the first, last, and most important thing you do. It's non-negotiable. Think Maslow, right? Basic safety comes before everything.
So imagine you hear a patient say something like this: I feel so depressed, and I honestly just don't see how I can go on much longer. Your ears have to perk up. That's not just someone feeling sad. That is a massive red flag. It's a critical cue that screams, I need help now, and you have to take immediate, focused action. And what's that action? You have to ask directly. This is not the time to beat around the bush. You look them in the eye and ask, are you thinking of hurting yourself or someone else? It might feel uncomfortable, but it is the standard of care. It's what you must do.
And this right here, this is the nursing process, ADPIE, in a nutshell for this situation. Look, it starts with assessment, and what's number one? Safety first. Once you've confirmed they're safe, then you can move on. You can get your diagnosis, difficulty coping. You can plan with them, implement some strategies, and then evaluate to see if it's working.
Okay, let's zoom out a little bit. It's so important to remember that crisis isn't a one-size-fits-all kind of thing, Every single patient walks in with their own unique story, their own world.
And crises basically come in two flavors. You have maturational crises. These are the predictable ones, the stuff that happens as we grow up, like getting married or retiring. Then you have situational crises. These are the curveballs life throws at us. A sudden car accident, a scary diagnosis you never saw coming.
So, when someone is just completely overwhelmed, when their usual ways of coping just aren't cutting it anymore, the brain does something pretty amazing. It pulls up these unconscious shields. They're called ego defense mechanisms. And their job is to protect the mind from anxiety that's just too much to handle.
And you will see this stuff all the time. Check out displacement, for example. A patient gets some terrible news, and then they start yelling at you. Is it about you? Nope, almost never. That anger is really their fear and anxiety just being redirected somewhere that feels safer. Understanding this is a game changer.
All right, last big topic, and maybe the most important one. We have to talk about us. We have to talk about the caregiver. Because here's the deal. A nurse's well-being is not a luxury. It's a patient safety issue, period. You've all heard it. You can't pour from an empty cup.
And it's really important we know the difference between these terms. Burnout, that's when the demands just crush your resources. Compassion fatigue, that's the emotional cost of constantly seeing people suffer. And then there's second victim syndrome, which is something very specific. It's the trauma a healthcare worker goes through after being part of a medical error.
And if you remember one thing about second victim syndrome, let it be this. The risk of suicide is frighteningly high. That's why immediate, non-judgmental support from peers, from the organization, isn't just nice to have, it's an absolute, life-saving priority.
Okay, let's put this into practice. Picture this. It's a gut-wrenching scenario. A nurse you work with makes a med error. They're having nightmares. They tell you, I don't even feel like a nurse anymore. So, what's going on? And what's the very first thing that needs to happen?
That's second victim syndrome. And the priority is not the paperwork, it's not the investigation. The absolute #1 priority is that nurse's safety, getting them immediate psychological support to assess that suicide risk and to protect them, period.
Okay, we've covered a ton of ground, so let's lock it all in. Here is your super quick, high-yield recap of the stuff you absolutely need to know for your next exam.
4 key things. 1. Allostatic load. Remember, chronic stress messes with your immune system. 2. Crisis intervention. Your first thought always is safety. Ask the direct questions. 3. Second victim syndrome. This is a huge suicide risk. Get them help immediately. And 4. Ego defenses. They're just the brain's unconscious way of protecting itself from too much anxiety. And that's a wrap for this explainer. So I'll leave you with this question to take with you to your next shift. After everything we've talked about, what's the first sign of stress you're going to be looking for? Not just in your patients, but in your coworkers and maybe even in yourself.